Why, hello there. My name is Ricky Studwell, and I am here to spread some more knowledge with you guys. Today, we're looking at toxicology and inhalation. There's many routes in our bodies that poisons can enter. There's ingestion, injection, absorption, and many others. But one of the most important ones is inhalation. Inhalation is a route through the nose and the mouth. This is where we typically breathe in oxygen that goes straight to our lungs. But sometimes we can breathe in poisonous toxins through our nose and mouth, which go directly to our lungs. Breathing a poison, typically a gas, vapor, fume, or aerosol, into the lungs allows for rapid absorption into the body. The poison is transported down the respiratory tract with each inhalation until it reaches the alveoli. Once in the alveoli, the poison can cross the alveolar capillary membrane and enter the bloodstream, where it is then transported widely throughout the body. This not only produces a more immediate effect than an ingestion, but also typically causes signs and symptoms to appear earlier with a tendency to be more systemic in nature. This mechanism produces a variety of signs and symptoms. The inhaled poison can also have direct effects on the pulmonary system by destroying lung tissue. This may lead to a pulmonary edema, which inhibits the effective exchange of oxygen and carbon dioxide at the level of the alveoli. Thus, severe respiratory distress in a patient may be an indication of an inhaled poison. Toxins and poisons that can cause inhalation poisoning are typically household supplies. Things like gasoline, oils, cleaning supplies, paints, and so on. It is important to know the dangers of these objects, and it is important to avoid inhaling large amounts of these objects. Now, how can you tell if you're suffering from inhalation poisoning? Well, some signs that may indicate poisoning are drug or chemical containers that are open, spilled, or out of place, unusual odors, spills and stains on clothing, skin, flooring, and etc., or acute or chronic symptoms from this poisoning. The symptoms can vary from mild to moderate to severe. Some symptoms may be behavior changes, dizziness, drowsiness, fatigue, headache, loss of appetite, minor skin or eye irritation, nausea or upset stomach, passing cough, or thirst. Some long-lasting symptoms of inhalation poisoning could be blurred vision, confusion, difficulty breathing, drooling, excessive tearing, fever, low blood pressure, loss of muscle control and muscle twitching, paleness, persistent cough, rapid heart rate, seizures, severe nausea, stomach cramps, sweating, trembling, and weakness. Now, what is the treatment for inhalation poisoning? Well, it is very important to maintain the patient's airway, as they can stop breathing, and their lungs may be badly damaged from the poisoning. It would also be helpful to find the cause of the poisoning. Therefore, you will get a better idea of what you need to do in order to help save the patient. If appropriate, give the patient activated charcoal. Also, be sure to give the patient the correct antidote in order to neutralize the effects of the poison or toxic substance. Well, that's all for today. Thank you for watching, and I hope you learned something new.